Welcome back to Inside Chlorpromazine, the podcast that explores the science behind this fascinating drug and its potential impact on COVID-19. I'm your host, Sowmya, and in today's episode, we'll be focusing on an exciting aspect of chlorpromazine's role in the fight against COVID-19, its potential in reducing the viral load. COVID-19, as we all know, is caused by the SARS-CoV-2 virus, and one of the key factors in determining the severity of the infection is the viral load, that is, the amount of virus present in the body. In this episode, we'll discuss how chlorpromazine might help reduce the viral load in COVID-19 patients and whether it could play a role in controlling the spread of the virus. To help us understand this, we are joined by Chythanya, a biochemistry graduate, a microbiology researcher with extensive experience in antiviral therapies. Welcome to the show, Chythanya.
Thank you, Sowmya, for inviting me.
Let's jump right in. One of the key challenges in treating COVID-19 is controlling the viral load. High viral loads are associated with more severe symptoms and greater transmission. So how does chlorpromazine play a role in reducing the viral load in COVID-19 patients?
It's a great question, Sowmya. Chlorpromazine, though originally developed as an antipsychotic, has shown antiviral properties in several studies. One of the ways it works is by interfering with the ability of the virus to replicate inside the host cell. SARS-CoV-2, like other viruses, relies on the host cell machinery to reproduce itself. Chlorpromazine has been found to disrupt the process by inhibiting certain cellular pathways that the virus needs to replicate. For instance, one of the mechanisms that chlorpromazine targets is the virus entry into the host cell. SARS-CoV-2 uses ACE2 receptor on human cells to enter and infect them. Chlorpromazine has been shown to inhibit the entry process, which could prevent the virus from spreading and replicating within the body.
So, in essence, chlorpromazine acts as a blocker of viral entry, reducing the ability of the virus to infect new cells.
Exactly. By blocking the entry of the virus into host cells, chlorpromazine can reduce the viral load in the body. Lower viral loads are generally associated with milder symptoms, reduced transmission rates, and better overall outcomes for patients. This is why repurposed drugs like chlorpromazine have generated so much interest in the fight against COVID-19. It could be a relatively easy way to slow the spread and severity of the disease.
In addition to blocking the virus entry into cells, are there any other ways that chlorpromazine interferes with the viral replication process inside the host cells?
Yes, there are. Another key aspect of how chlorpromazine works is by affecting the host cell machinery that the virus hijacks to replicate itself. So SARS-CoV-2, like all viruses, relies on the host cell's machinery to produce viral proteins and replicate its RNA. Chlorpromazine can inhibit cellular processes like protein folding and trafficking, which are essential for viral replication. So one of the specific target is the endosomal pathway, which is critical for the virus' ability to uncoat and release its genetic material inside the host cell. By interfering with the process, chlorpromazine can significantly reduce the amount of virus produced in the infected cells, leading to a lower viral load.
This is really fascinating. Chlorpromazine is not only blocking viral entry, but also disrupting the virus' ability to replicate inside cells. So, in theory, it could potentially prevent the virus from making copies of itself and spreading further. But are there any studies or trials that have looked at chlorpromazine's effect on viral load in COVID-19 patients specifically?
Interfering with the process, chlorpromazine can significantly reduce the amount of virus produced in the infected cells, leading to a lower viral load.
This is really fascinating. Chlorpromazine is not only blocking viral entry, but also disrupting the virus' ability to replicate inside cells. So, in theory, it could potentially prevent the virus from making copies of itself and spreading further. But are there any studies or trials that have looked at chlorpromazine's effects on viral load in COVID-19 patients specifically?
Yes, there have been a few studies that explore chlorpromazine's potential in reducing viral load in COVID-19 patients. For example, some in vitro studies, which are done in a laboratory settings with cells, have shown that chlorpromazine can inhibit SARS-CoV-2 replication. There have also been a few clinical studies that examined the effect of chlorpromazine in patients with COVID-19 with promising results in terms of viral load reduction and symptom improvement. However, it's important to note that these studies are still in the early stages. While the results are encouraging, we still need more data from large-scale clinical trials to fully understand the drug's efficacy and the optimal dosing regimen.
That's great to hear. But with the use of any antiviral agents, there always the risk of viral resistance. Is there any evidence to suggest that the virus could become resistant to chlorpromazine and how it might impact its use in COVID-19 treatment?
That's a very important question. With any antiviral treatment, there is a concern about the potential for resistance developing over time, especially if the drug is used widely. However, chlorpromazine's mechanism of action is quite different from that of traditional antiviral drugs. Since it targets host cell machinery rather than the virus itself, the chances of the virus developing resistance to chlorpromazine are likely lower compared to drugs that directly target viral proteins. That said, resistance is always a concern, and we need to monitor the effectiveness of chlorpromazine over time. Additionally, the development of resistance could be mitigated by using chlorpromazine in combination with other antiviral treatments, which could help prevent the virus from adapting to any one treatment.
Speaking of combination therapy, could chlorpromazine be used in combination with other antiviral or immune modulating drugs to improve its effectiveness against COVID-19?
Mm, Absolutely. Combination therapy is often more effective than monotherapy, especially when dealing with complex viruses like SARS-CoV-2. Chlorpromazine could be used in conjunction with other antiviral drugs or immune modulators to provide a multifaceted approach to treatment. For example, pairing chlorpromazine with drugs that target the viral replication processes directly or with immunosuppressants to control the immune response could enhance its ability to reduce viral load and improve patient outcomes. In fact, some early stage studies have already stated looking at this idea, the goal would be create a comprehensive treatment protocol that uses multiple drugs to target different aspects of the virus and the body's response, which could help tackle the virus more effectively and reduce the chances of resistance developing.
This has been such an insightful discussion, Chaitanya. As we wrap up, do you have any final thoughts on the role of chlorpromazine in reducing viral load and its potential use in the treatment of COVID-19?
I think it's important to remember that chlorpromazine is still in the early stage of research as an antiviral agent for COVID-19. While the preliminary data is promising, we need more research to confirm its effectiveness and safety. That said, its potential to reduce viral loads, especially when combined with other treatments, could make it valuable tool in managing COVID-19, particularly in controlling the spread of the virus and reducing the severity of symptoms. It's an exciting time for antiviral research, and chlorpromazine is definitely one of the drugs worth watching in the fight against COVID-19. Thank you for having me, Sowmya. It's been a pleasure to share this information with your listeners.
And thank you to all our listeners for tuning into another episode of Inside Chlorpromazine. Be sure to join us next time as we continue to explore this fascinating drug potential in the fight against COVID-19. Until then, stay safe and stay curious. Thank you.